Hi everyone, my name's Nick Smith. I'm the City Council Strategic Intelligence and JSNA Manager. That's a Joint Strategic Needs Assessment. And I think in some ways, I'll just flick onto the first slide. What I'm doing, obviously, keeping a track on time, 6-minute presentation is pretty nifty. This is about looking at the status quo to some extent. This is about what data do we have now. This is pretty much, it's all aggregated data, but it's the kind of data sets that if we could get under the skin of this better and look at how then these link across to each other and where the data sources are and how you can then get more an analysis of the individual level data, the wealth that that could then open could be huge. But I'll just quickly skip through some of the kind of, I know some of you in the audience are clearly very familiar with JSNAs, others may not be at all. So I'll just give you a sense of what kind of data levels they are, what data sets there are. All of this is publicly available data. We've got most of this down to ward level data, and it can be accessed by anyone through the council's website. And I'll at the end note at some point where we are doing work to develop the JSNA this year. First data set, this is population. We've got a lot of kind of building block type data, population information, whether it's census or the annual updates that come through from the ONS on the Bristol population. Obviously the exact same data is available for all the local surrounding authorities as well. So if one wanted to do work based on this, there is a lot of detailed analysis that's available. In this particular example, this is the change over the last 5 to 6 years by the 3 localities of the NHS Clinical Commissioning Group here in Bristol, split by children, working age adults and older people. Just shows how completely different that population change has been depending where in the city you are. Next data set to check up is deprivation. So we've recently had new indices of multiple deprivation. 2015 came out after a 5-year wait for that. And what does that show? It shows us that in Bristol, 16% of people live in what are the nationally 10% most deprived. Obviously, that is clearly above the national average, but to be honest, that is probably similar for a city. But when you look at that by children, it's 22% of children live in the 10% most deprived areas. Older people over 65, it's 14%. But it is rising. When we look back at the last time this data came out in 2010, we had at that point, looking at the 1% most deprived part of the country, there was just one part of Bristol in that area. There's now 6. And this is very much in South Bristol, Knoll West, Hartcliffe. These areas are, the deprivation of those areas are intensifying. Life expectancy, one of the core kind of public health data sets. The Bristol, obviously life expectancy is rising, there's no surprise there. But where it is for Bristol is, the Bristol male life expectancy for men is significantly lower than the national average. And the looking at the green and blue on the bottom line there, green being national, blue being Bristol, that gap is not shifting, and if anything is, in the last few years it appears to have been getting slightly larger. And the inequalities gap, Ted was mentioning inequalities, and the JSNA 2015 data profile report we put out at the end of last year, inequalities was the key theme there, because the fact that those inequalities haven't really shifted, that is clearly one of the major issues that need to be looked at. And for men, it's nearly 8-9 years between the most deprived and least deprived areas. 9 years difference in life expectancy, and for women it's 6.6 years. But looking at that as healthy life expectancy, this is where that data is then cross-referenced with national survey data as to whether people feel in good health. Male and female life expectancy there are pretty much the same, which means obviously then that women live about 5 years longer in poor health on average. But again, looking at that inequalities gap, then the gap between the people living in the most and least deprived areas, that is around a 16-year gap in the number of years that people live in good health. So that is a very significant gap for the people in the most deprived parts of Bristol. And that is that Bristol does have a bigger gap than most places. In fact, that is probably one of the big themes that come up. Bristol does very well on a city average, if you're looking at Bristol against other places, but when you get under the skin, the inequalities within Bristol are starker than in most places. I'll just quickly throw up a few other data sets. Early deaths due to cancer, significantly higher in Bristol for men and women, and again, that pattern hasn't changed over many years. And conversely, cancer screening coverage for most kinds of cancer in Bristol are lower than the national average. Cardiovascular disease, again, the rates are higher, not by the same margin as the Alpha cancer, but they are still higher, and in the last few years that gap has slightly increased. But what we've pulled out there, though, in the bar charts, that is just again looking at the localities within the CCG in Bristol and looking at some of the differences between those areas. In the north and west inner, which is like Stoke Bishop, Clifton type areas, these rates, and it's the same pattern on most of the premature mortality, the rates in those areas are significantly lower than the rest of the city. And in the inner city and north and west outer, which is the northern arc across the top, from Avonmouth over to Henbury and Southmead to Lochleys, those rates are particularly high. So overall, preventable mortality, on average, we reckon there's around 675 preventable deaths per year in Bristol, which is it's reducing, but it is still significantly above the national average. What are the contributors to that, though? Overall, this is using national data. Dietary risk, tobacco and obesity, they are the major contributors. Clearly, a better understanding of people's lifestyle issues and the wider determinants of health that then cause people to take particular choices, that's how we then need to get behind what's happening here. I'll just use these actually to flash up more the maps we've got. A lot of this stuff uses to look at the ward level data we use in quality of life, which is a robust survey that we carry out in the council every year. Go that to about 29,000 people. We get usually 4,000 to 5,000 responses back. That can then be used to look at the responses to a whole host of different indicators at ward level and by quality group as well. So we can start to do that work then of cross-cutting some of the issues. This particular one, actually this is using school nurse data on reception year children who measure as overweight or obese, and the point of that is the difference in the ward maps. Northern Arc, inner city and South Bristol, how different that is, and whether we do that for reception year children, children leaving primary school or indeed adults, you see a broadly similar picture there. And the numbers show from 5-year-olds being 23, 1 in 4 5-year-olds being overweight, to 1 in 3 children leaving primary school, to over half of adults. It's clearly a very significant issue. Smoking, you see similar patterns. The number of people smoking in Bristol is going down here nationally, but it's still a significantly higher number of smoking-related deaths in Bristol, and the local data allows us to see some of the differences, as is with alcohol, which is another particular issue in Bristol. Right, so just stepping back for a minute, what more do we need? As I said at the beginning, all of those is often nationally available data, it's locally available data, and it's aggregated to ward level at the lowest level. There's no individual level data there, even though it may sit underneath there, but that's not available. So we know we need to do more with this. We need to do more work about, well, what does this tell us? This is the need, but what are the assets? What are the positives? What's happening in the community? What is the level of need that is required there? And what can we do about that? So we're going to be producing a range of JSNA chapters that will be starting this year, that will start to look at the service user views better, looking at the stakeholder views, as I said, looking at services and assets, and looking at pictures of cost effectiveness, so we can start to give recommendation then for what should commissioners do differently. And I think that's where I need to leave it. Oh, that's the end of that one. All right, thank you.